Good morning, and thank you for joining us for today's webinar. I'm Ruth Richardson. I'm the Director of Programs and National Strategic Initiatives for the Minnesota Organization on Fetal Alcohol Syndrome. Today's pre-proposal conference is focused on the regional collaborative to reduce the incidence of prenatal alcohol exposure and other substances in children born to women in recovery in Minnesota. Thanks for joining us today. Before we get started with today's session, just wanted to go over a number of housekeeping items with you all. All attendees have been placed in listen-only mode for the duration of the webinar. The webinar is being recorded and will be posted later on this week for viewing on the MOFAS website. You can access that by going to mofas.org and following the links for the Chemical Health and Recovery request for a proposal. The PowerPoint handout for today's materials is attached, and in the toolbar on the side you should see a link that says materials. You can expand that, and if you'd like to download the materials during the session, you'll be able to download those to follow along. At the end of the session today, we will have an opportunity for question and answers, and you'll be able to ask your questions in one of two ways. You can either indicate that you have a question by raising your hand, and we'll be able to unmute you so that you may speak your question, or you can use the chat box at the bottom of the toolbar on the side of your screen, and you can type your questions in. We will monitor the questions that are coming in through the chat box, and we'll also look for hands raised to be able to unmute you to ask any questions. So again, welcome. We will have an overview of the grant opportunity. We'll also talk about the application process today, and Kendra Glick is also on the line, and she's going to help carry us through the application process after we do a quick review of the grant opportunity. And as stated before, we will open it up then for question and answers. So a little bit of background on this request for proposal. This project is funded by the Minnesota Department of Human Services, and the role that we have as an organization, MOFAS, is that we're responsible to coordinate the RFP process. We'll also be coordinating the review committee and panel meetings, and once contracts are awarded, we would be the entity that you would be working with from a contract management perspective. We are also responsible to facilitate quarterly grant meetings related to this request and to provide ongoing technical assistance throughout the process to the eventual grantees. A little bit more background in terms of the scope of the RFP. We are seeking proposals from qualified providers to provide community-based recovery services and supports for women that are pregnant and parenting, and we have a priority focus on women who are struggling with alcohol use disorders. As you could see in the title, we are also working with women that may be struggling with substance use disorders as well, in situations where there might be polysubstance use, but a real priority focus with this grant funds is going to be on women with alcohol use disorders and or who are at risk of having a child with fetal alcohol spectrum disorder. This grant is actually a continuation of a previous grant cycle, and we were lucky enough this past legislative session to receive funding to be able to expand this program. We currently have 2 existing grantees that are doing this level of community-based recovery supports that's really focused on wrapping services around families who are dealing with alcohol use and substance use disorders. Because this is a continuation and expansion of programming, we have lots of lessons learned and lots of practice pointers for eventual grantees. And an important part of the quarterly grant meetings that we anticipate having, and also the orientation, is to really take some of those lessons learned to be able to support any new providers that are funded to be able to learn from what we have over the last several years. The amount of funding that is available is $220,000 per year, and the project is slated to continue through the end of June 30th, 2019. And during this process, MOFAS and DHS will be reporting back to the legislature on outcomes, so we have a really short period of time to make an impact within our communities, report back to the legislature, and the goal is to be able to go back with some really good evaluation findings so that we're able to secure ongoing funding for this project. A little bit about the framework for the project. So something new that is required with this round of funding that wasn't required previously, it requires that a regional collaborative either be established or be identified. Some of you may already have something akin to a regional collaborative going on. The minimum requirements for the regional collaborative, it requires that at least one of the members be a county or some governmental entity, thinking about a local governmental entity. So a city or a county could meet that requirement. A tribe could also meet that requirement as well. Another requirement with the regional collaborative is that there be at least one community-based organization that's a member, and it also must incorporate some form of home visiting. So if the community-based provider provides home visiting, that would meet that requirement, or you may collaborate with an outside entity from a home visiting perspective in order to meet the minimum requirements of the regional collaborative. And again, that's just the minimum requirements. The goal is that regional collaboratives will be established with diverse groups of stakeholders, which would also include individuals with lived experience. It could include things like corrections or probation, child welfare, child protection, early childhood, really thinking broadly about what types of supports and services that families really need to get the best level of community-based recovery supports. So thinking very broadly about the regional collaborative is great, and the more diverse the collaborative, the better from our perspective. This grant is going to be focused on both urban and rural areas. And again, we talked about the importance of the priority population, and just want to again stress that again, we're looking at women who are pregnant and parenting, and a priority focus with histories of alcohol use disorders. The wraparound service model is also going to be very important in terms of what we see as a framework for the project, and really begin thinking about providing intensive case management services around the family that the woman really identifies as her family, and that can also include supporting male partners as well if they are identified as part of that family unit. And the ultimate goal for the grant funds is to increase the number of toxic-free births. That is an evaluation area that the legislature is very interested in getting reported back on. They want to know ultimately, with the investment of these funds, how many babies were born with clean tox screens. Some of the examples of core services are on the next couple of slides. Again, this information is also in the request for a proposal, and it includes a much more comprehensive set of core services, but I wanted to talk about some of the most important services to be able to identify within your proposals. The ability to develop comprehensive care plans for women and their families is going to be really important, and we're thinking about it in terms of that intensive case management piece to really look at the supports that are going to help people be most successful within their recovery. I've talked about the importance of the birth toxicology reports. Again, that's something that the legislature is looking forward to us reporting on. Another important piece is the UA screening that should be happening periodically as well. Resource development and resource navigation is an important piece, and really thinking about developing recovery support networks within the communities that the women that you are serving are touching, and thinking very broadly about those services. If there are barriers or if there are issues related to housing, employment, or maybe even accessing benefits, thinking about how we can help support these families to really increase their stability, especially as it relates to economic factors, is an important point as well. Helping families to access health insurance will also be one of the core requirements of the grant, and helping to establish primary care medical homes for women and their families is going to be very key and important as well. Thinking about support for parenting, training, and other forms of support, and how that can be provided in a supportive and non-judgmental way is key. And for the children who might be sort of clients as well through serving their mother, thinking about the screening for things such as any physical, behavioral, or dental needs. We want to ensure that kids are up to date on their immunizations and other things as well. One other thing I'll add as well before I go into some of the important considerations, we're also thinking about screening broadly in terms of thinking about how we can be screening the women clients for things such as sexually transmitted infections, because maybe there's an opportunity for referrals if that is a need. Thinking about things like tobacco cessation and other type of mental health or medical needs that the women may have as well. So moving on to some important considerations, we are prioritizing funding organizations that are trauma-informed and are delivering trauma-informed services. We know the vast majority of the women that we anticipate will be served through this project will have histories of trauma. Their children may have histories of adverse childhood experiences. The women may have those histories as well. So it's very important that the services being provided are trauma informed. We're also interested in culturally informed services as well. If your organization is really focused on providing culturally specific services, that is something that you're going to want to highlight within your proposal. If your organization is focused more on services generally, not specifically focused on any cultural group, you want to identify that as well. What we really want to be able to understand is what is the profile of women that you really anticipate that you are in the best position to serve. So we know whether you're looking at providing really culturally informed services for a specific group, or if you're looking at serving women broadly across many different communities. The active and meaningful engagement of individuals with lived experience is also something that proposals will be evaluated on. We are very interested in funding collaboratives that are actively engaging individuals with lived experience. And there's a few different ways that that can be done. Sometimes we have individuals providing services as recovery coaches. Sometimes there's individuals with lived experiences that might be parts of collaboratives. And what we really want to be able to understand is, what are your organizations currently doing to really meaningfully engage these populations? So if there's something that you're currently doing, be sure to highlight that, because we want to know that, again, because that's something that you'll be evaluated on. If you have some new ways that you're thinking about actively or meaningfully engaging this population with lived experience in, tell us about that as well. And with what we just really want to understand is what you're currently doing to actively engage and what you may do in the future. So just be clear on whether it's something you're currently doing or thinking about doing if you were funded through this grant. So with the grant, there are two opportunities available for funding. Thinking about it from the perspective of, you can either request an expansion grant, or you can request to become a new grant. And what it means to be an expansion request, that would mean that you already have an existing regional collaborative, and that with that regional collaborative, you're expanding and seeking additional funds to really grow the services in some way. And you can be thinking about growing maybe the number of people that you're serving. That would be a rationale that we would consider. It could be increasing the service delivery area. So maybe you're thinking about expanding outside of a particular county into another county. That would be another rationale that we would accept as well. Or it could be serving women and children for a longer period of time. So just keeping in mind that if you are requesting expansion funds because you already have a regional collaborative that is established, that meets the requirements, then you would really need to identify what that rationale is. If you are a potential grantee who is looking to start a new regional collaborative, what is going to be very important is that you demonstrate the ability to begin providing services within 1 quarter. So looking at within the first 3 months of receiving the grant, that you would be ready to go with all, having accomplished all the planning and everything that needs to be done in a really short time period of 3 months. And the reason that we are really stressing that new grants must be ready to go within 3 months is that we have a very short window of time in which to show outcomes, and because of that, we need folks that are applying to be ready to begin serving women as soon as possible. In the RFP, we talked about the fact that at least 2 grants are anticipated, and we anticipate that it would likely be at least 1 expansion grant and at least 1 new grant. We are saying that basically as a minimum. There could be 3 grants. Part of the inquiry is going to depend upon the number of proposals that are received and the amount of funds that individuals are requesting. And just a reminder that those who are ultimately selected as grantees, the participation in grant meetings is something that is going to be required as part of the grant. So now I'm going to turn things over to Kendra to talk about some of the specific process for the application.
Thank you, Ruth. I will get started here with some key dates that I'd like to point out, the first one being today. The deadline for submitting questions is today at 4 o'clock. This way, if there are questions that you think of beyond the webinar has ended and you still want to submit those, you can email them to me. My email is there, kendra@mofas.org. And then after today at 4 o'clock, we will take all those questions and the responses and have them posted tomorrow on the same website page where all this information is. It's the same place where you registered for this webinar. We'll post all of the responses to questions that were asked in all the pre-proposal meetings and any questions that were submitted to me. That way everyone has access to the same information. So once that happens, you'll have everything on the website that you need, and then the grant application is due November 6th at 4 o'clock. There are two ways to submit your grant application. You can email it to me, again at kendra@mofas.org, or you can submit a mailed copy. We only need one copy if you are submitting it by mail, and you'll see you send it to the MOFAS address. All of this is in the RFP. You can also hand deliver a copy if that's something you'd like to do, but just as long as they're in by 4 o'clock. And for those submissions that I receive by email, I will be replying to make sure that you know that everything came through, all of your attachments were received, and verifying that your application was submitted. And then once we have those applications and conclude the review process, the review committee, and any site visits that need to happen, the goal is for those contracts to begin as soon as possible. So as I mentioned, we'll be posting the responses to any questions that are submitted. You can also see we have a frequently asked questions document on the website that may answer questions you already have. So be sure to check that out as well. As far as the application materials go, you will see on page 5 of the RFP there is an application checklist. So that lists all of the documents that are required for your application. 2 of them are fillable forms right in the RFP, so they are a PDF that you can fill out. And then the narrative has a requirement of not to exceed 7 pages. And the rest are all financial documents that you will include with your application. For the regional collaborative, we do ask that you identify who they are using the table that is in the RFP. So there are 3 columns to create. One is to identify the organization or the entity. The second one is to say if that is a proposed or secured partner, and then the third one is to describe their role in the collaborative. So be sure to complete that table so that you can be clear about who it is that you are including in this collaborative. Letters of agreement are not required as part of the application itself, but if you have them, you are welcome to submit them as well.
And one thing I would add as well is that if you do have existing collaboratives and you're able to show those letters, that actually can really help to strengthen your application, especially for the existing collaboratives as well.
Okay, so then there's another section in the RFP in the narrative portion where you are asked to describe the services provided. So if you are a new collaborative, be sure to describe these services thoroughly, both for the women in recovery and also their family, paying close attention to the services that are provided for the children. And be sure to identify when you're talking about these services, are they in-house or is it a referral? Is it something that is provided by one of the partners in the collaborative, and if so, who it is? Just to be clear about how these services are going to be provided. If it is an expansion request, this is the section where you are asked to describe the current gap in services and provide the justification to support the need for those expansion funds. So that is in the narrative section under the heading description of program. I also want to bring your attention to the grant contract terms. It is Very important that you review these grant contract terms before you enter the application process so that you have time to read through them and make sure that the appropriate person on your part of the collaborative reads them, and there's a part in the application where you either accept the contract terms, or if you do not accept the contract terms, you attach your exceptions to those contract terms. So that is on the required statements document. Under the anti-discrimination agreement, you'll see the place where you can review those contract terms. They are posted on the website now if you follow the link that is provided. And if you have exceptions, you can include them as an attachment to your application. Just know that some material exceptions will not be accepted and could result in not being funded.
And Kendra, can you just clarify that if there are exceptions to the grant contract terms, that's not included in the 7-page narrative, correct?
Correct. Yes, that is a separate attachment. Correct. Okay, so there is also a budget form that you will use, and that is, again, provided on the website for you to download, complete. It's an Excel form, and then submit either, on paper if you're submitting that way, or as part of your electronic submission. Do not create any additional categories on these budget forms. Stick to the ones that are already on the budget forms there. And I do want to note that one of those lines, I know it's a little harder to read them on the webinar visual here, but you can see them clearly on the document themselves. One of those is staff development. And so if you are putting funds in your proposed budget in the staff development line, you really need to note why it is needed for this grant. What is the purpose of that staff development, and how is it related specifically to the grant work that is being proposed? So we'll just be clear with that and also address it as part of your narrative. I also want to point out the small print at the bottom related to gift cards. So that the words there clarify that any gift cards may be provided as an incentive up to a total of $20 per participant per incentive, and those gift cards cannot be used to purchase alcohol, tobacco, or illicit or illicit drugs, including energy drinks. That is something that we need you to adhere to, so pay close attention to that as well if that is going to be part of your budget. So this first sheet is the purple is your entire project, and then the second sheet you'll see is blue, and that is your proposed budget for this grant, what you're requesting from MOFAS as the grant proposal.
And one quick thing that I would just add about the staff development as well, with the required quarterly grant meetings that DHS is requiring, there are going to be learning and development opportunities as part of those quarterly meetings as well, to really help support all the grantees with technical assistance. So just kind of a heads up on that there will be some development that goes on as part of the technical assistance of the grant itself.
And there you see that's the blue form. That is the one that you use specifically for the grant dollars that you're requesting. So as you're creating your budget, please take note of these. All expenses should be based on actual itemized costs. So no flat fees, administrative or otherwise, are allowed. Administrative fees are limited to 10% of the overall budget and must be itemized. If there are any travel expenses that are out of state, they are not permitted for Minnesota companies and organizations. If your entity is located outside of Minnesota, travel expenses are permitted for the purpose of you traveling within Minnesota to to be able to implement the grant. Also, if you are considering equipment, usually if you are considering things like a laptop or other equipment that is related to technology, please note that the purchases that will depreciate will require pre-approval. So that is something that you may want to consider if you're thinking about equipment. And then there are other submissions that we require to ensure the financial health of the grant applicant is reviewed. So these are again listed as part of the application checklist. One is other sources of funding for the proposed project if applicable. So there's nothing that is required, but if there is leverage funding, could be cash or in-kind, that does strengthen the application. Also, the applicant's current year operating budget with the most recent actual expenses compared. So your budget to actual. Proof of tax-exempt status if applicable. Your most recent year-end financial statements, and your most recent tax return. Now, if you are submitting this by email, and some of these document files are quite large, it shouldn't be an issue, but like I said, I will confirm once I accept them that they all came through so that you can know that all of the attachments were received. So with that, I will open it up to anyone that has any questions for us.
And again, just as a reminder, if you'd like to speak your question, there is an icon to raise your hand and we can unmute you, or you may use the chat box on the toolbar and enter your questions there as well. Okay, it looks like someone has a question. Let me see if we can. So there's a few questions that have come in now. So the first one is, to be considered an expansion grant, does the existing collaboration need to have been previously funded by MOFAS? And the answer is no. If you have an existing regional collaborative, again, that includes a county or a local form of government or a tribe, and a member that is a community-based organization and home visiting, that is sufficient to qualify as an expansion grant. It does not have to be previously funded by MOFAS. The next question, we noted that MOFAS is only planning on making 2 grants, one for Metro and one for outside. Will a culturally specific collaborative be competitive, or would we need to expand our collaborative to serve mommies of other races and cultures? So a point for clarification, we intend to make at minimum 2 grants, but again, depending upon what how many proposals that are received and how much funding individuals are asking for, or entities or collaboratives are asking for, there could potentially be the opportunity for more than 2 grants, but we anticipate making at minimum 2. And in terms of what's going to be the most competitive, we are really going to we're really going to focus on expansion grants and new grants that demonstrate the ability to get started quickly. If you are providing cultural specific services, that is also something that we definitely want to know about. We want to be able to understand whether you're providing culturally specific services or services for women generally. But again, in terms of what are going to be sort of the priority focuses, it's going to be on those who can get started quickly, those that have trauma-informed services, and also remember the priority consideration for women who may be struggling with alcohol use disorders specifically, or may have alcohol use disorders associated with other forms of polysubstance use. Do you have anything to add to that, Kendra, at all?
No, I don't.
Okay.
I covered it.
The next question, can we regrant or award contracts to other service providers within our collaborative? Are there any guidelines on how this should be done? So in terms of including payments to other providers, that is something that you could potentially do, and there is a line within the budget form for consultants or contracts, and there you would be able to identify whether you anticipated paying funds to another entity. If that is something that you anticipate, you really want to identify within the budget justification line who that provider is and what you are paying, what you would be paying them for, and giving some indication of the scope of what that would be. So for example, if you anticipated that you would be serving 50 pregnant or parenting women, and you anticipated that this provider was going to work with all or some of those women, giving some sort of estimate in terms of this provider is going to provide X service to 30 women would be really helpful for us to be able to understand any sort of support to outside entities that would be wrapping services specifically, specifically around the women. 3, when you specify that the contract will be reimbursement only, is the reimbursement based on services provided or on outcomes, or what will the criteria be? Kendra, do you want to talk about the reimbursement piece of the contract funds?
Sure. So the reason it's reimbursed, it's different than a grant where you may receive all the grant funds up front. So we receive invoices and quarterly reports as part of this grant. The invoices will be monthly, and as long as they are approved, they must be approved to receive that reimbursement. So just that the funds are being used in the manner that they were intended to be and meet the requirements that we have set forth in the contract. So if those funds are being used appropriately, then you will be reimbursed for the expenses incurred, and it's based on it's not evaluation of anything beyond that.
The next question we received, what type of formal documentation does the grant require for the toxicology reports? And typically what our current providers have been getting are the toxicology screens from the hospitals themselves. And if there are additional questions about what that entails, that is definitely something that you could reach out to Kendra about, and we can also add that to the frequently asked questions if that's not resonating with you. There's a few folks who are having some difficulty downloading the PDF file of the presentation. No worries, we can also email that out to everyone who registered today. So if you are not able to access the PDF, that can be, we'll just email it to all the registered attendees following the completion of the webinar. So we'll give it another moment to see if any other questions come in. And it doesn't appear that anyone has a hand raised at this time. So seeing no more questions, again, if you think about something that after the webinar ends, please send those to Kendra today. Again, her email is kendra@mofas.org, and she's accepting those questions through the end of the day today. And again, all of the responses to the questions that were received today and the questions received yesterday at the in-person pre-proposal conference will be uploaded later this week. I think, Kendra, the plan was to have those updated by Wednesday, if I'm not mistaken.
Yep, they should be.
Okay, and we should also have the link to this recording as well if there's someone else within your organization that needs to access it. So thank you again for joining us today. We are very excited to see the proposals come in early next month, and I hope that you all have a really great afternoon. Thank you.
Thank you.